we need to look at what happens in the body when we go into long-term fasting. When we stop eating, we stop receiving energy with food, including in the form of carbohydrates, that is glucose ultimately. Once the existing glucose and glycogen stores have been used up, our body begins to switch to alternative fuel sources. For example, fatty acids are mobilized from the fat tissue and liver starts producing ketone bodies from these fatty acids. And these ketone bodies are ultimately used as energy by different tissues, including brain. In individuals with normal pancreas beta cell function, the beta cells are the ones that produce insulin, as ketone body production increases, there is an activation of feedback loop from insulin. And insulin both suppresses lipolysis, which is the breakdown of fat that frees up fatty acids to subsequently use them for ketone body production. And insulin also inhibits the enzyme involved in the ketone body synthesis. So in individuals with normal insulin production, ketone body overproduction is prevented by insulin. And ketoacidosis, which is a dangerous condition that happens with too much ketone bodies around, doesn't occur. Conversely, if we think about individuals with impaired insulin production, such as persons with type 1 diabetes, insulin cannot control ketone body production because there's not enough of it around, and ketoacidosis is a real life-threatening risk. So despite the fact that type 1 diabetes is an autoimmune disease and long-term fasting is stipulated to be effective to some extent to get autoimmune diseases under control via reducing chronic inflammation, it is not a safe tool for patients with type 1 diabetes. Maybe it is possible in a medically supervised environment with insulin supply, with ketone measurement. However, don't try that at home.